From KETK, you're watching East Texas Live.
Welcome back. Joining me now is Dr. Langford with Azalea Orthopedics, and he's here to talk about the services they offer. How you doing today?
I'm doing great. Thanks for having me.
Yes, sir. So what is your specialty that y'all provide at Azalea?
Yeah, so I'm an interventional pain physician. I'm originally from San Antonio, Texas. I did medical school there. Then I went to the Mayo Clinic in Rochester, Minnesota, where I did an anesthesiology residency. Then I went to Vanderbilt for a pain fellowship in Nashville, Tennessee. I went back to Mayo Clinic to be on staff, and then recently my wife and I decided to move to Texas, and we're happy to be with Azalea Orthopedics. And as far as interventional pain management, it involves a lot of procedures and interventions that I try to offer my patients to help decrease pain, improve quality of life, and improve their functionality.
Yes, sir. What are a couple of procedures that you kind of offer to your patients?
Yeah, I have a wide range of procedures I offer, including epidural steroid injections, ablation procedures, nerve blocks, joint injections, and some more advanced procedures, including kyphoplasty, which involves a balloon and cement to help stabilize fractures, peripheral nerve stimulation, basovertebral nerve ablation, and spinal cord stimulation.
Yes, sir. And so who would be a good candidate for these type of kind of procedures that you do?
Yeah, so it varies based off the procedure we're talking about, but as far as epidural steroid injections, if they have narrowing in their back seen on MRI and have back and leg or neck and arm pain, then they could benefit from an epidural steroid injection. Patients that are osteoporotic, that have compression fractures, could benefit from kyphoplasty if they have severe back pain. And then patients who have diabetic painful peripheral neuropathy could benefit from spinal cord stimulation, as well as patients that have had lower back surgery but continue to have back and leg pain.
Yes, sir. And so what are the main indicators that a person would benefit from receiving interventional pain management care?
Yeah, so as I like to see patients who have trialed physical therapy as well as or a home exercise program, trialed over-the-counter medications, but continue to be struggling with their pain. Ideally, if they have pathology that has been seen on imaging that kind of correlates with their clinical symptoms, then that would be a good indicator that they could benefit very well from interventions.
Yes, sir. And so can you tell us a little bit about the steps you take in assessing the treatment plan for someone suffering with that pain?
Yeah, absolutely. So before I even see the patient, I review the outside medical records that I have available to me, as well as any imaging that is relevant to their pain. So if they're coming with back and leg pain, I'm looking at their low back x-rays as well as their low back MRI prior to me even seeing the patient. Then when I see the patient, I ask them a lot of detailed questions that are relevant to their pain, as well as perform a detailed physical exam. If they need additional imaging, then I'll order some imaging. And then in combination between the history, the physical exam, as well as the imaging, I come up with what I think to be the most likely cause of their pain, and then offer them treatment options based off that.
Yes, sir. And where can people get more information and find you?
Yeah, they can go on our website at azaleaortho.com for more information.
All right. Well, thank you so much for coming in.
Awesome. Thanks for having me.
Yes, sir. For more information, go to the website right there on your screen.